Hi, this is Reloba. In this video, we are going to talk all about the drug Sucralfate. By the way, Sucralfate is the generic name and the known brand names of this drug is first, Carafate, second, Aposucralfate, and third, Sulcrate. This drug is therapeutically classified as an anti-ulcer drug. It is also pharmacologically classified as a pepsin inhibitor. This drug is categorized as a pregnancy category B. When we talk about the mechanism of action of this drug, it forms an anti-ulcer adherent complex at the duodenal ulcer site, protecting the ulcer from acid, bile salts, and pepsin, promoting healing of the ulcer. It also inhibits pepsin activity in the gastric juices. Sucralfate is rapidly absorbed after oral administration. It crosses the placenta and it may enter the breast milk. This drug is metabolized in the liver and is primarily excreted in the intestines into feces. This drug is indicated and is used for short-term treatment of duodenal ulcers, maintenance of duodenal ulcers at reduced rate, dose after healing in adults, treatment of oral and esophageal ulcers due to radiation, chemotherapy, or sclerotherapy, and it is currently under investigation for treatment of gastric ulcers, gastric damage induced by NSAIDs, prevention of stress ulcers in acutely ill individuals. Sucralfate is contraindicated and should not be given to any person with known allergy to the drug or any of its components to prevent hypersensitivity reactions. It should not be given to patients with chronic renal failure or dialysis because buildup of aluminum may occur if it is used with aluminum-containing products. It is advised to use cautiously in patients who are pregnant or lactating because of the potential adverse effects of the fetus or the neonate. These are the known side and adverse effects of the drug. We have dizziness, sleeplessness, vertigo, insomnia, rash, pruritus, constipation, diarrhea, nausea, indigestion, gastric discomfort, dry mouth, and back pain. Before the administration of the drug, the nurse should first assess the client for any condition which could be a caution or contraindication of this drug, any history of allergy to sucralfate to prevent hypersensitivity reactions, renal dysfunction or dialysis which can lead up to buildup of aluminum, and current status of pregnancy and lactation. Perform a physical examination to establish baseline data before beginning the therapy. This is to determine the effectiveness of the therapy and to evaluate for any adverse effects associated with the drug therapy. The nurse should also inspect the skin color and evidence of lesions or rash that may indicate adverse drug effects. It is also the responsibility of the nurse to assess the patient's neurological status, including level of orientation, affect, and reflexes to monitor for CNS effects of the drug. The nurse should also examine the abdomen, auscultate for bowel sounds to evaluate GI motility, evaluate bowel elimination pattern or changes that could suggest possible adverse effects. The nurse should also assess mucous membrane status to evaluate potential absorption problems. And lastly, monitor the laboratory test results such as renal function studies to identify the need for possible dose adjustments and toxic effects. The nursing diagnosis related to the application of this drug therapy include the following: diarrhea related to GI effects, risk for constipation related to GI effects, imbalanced nutrition less than body requirements related to GI effects, disturbed sensory perception related to CNS effects, and deficient knowledge regarding drug therapy. The planning formulated by the nurse should include the following. First, the patient will receive the best therapeutic effect from the drug therapy. Second, the patient will have limited adverse effect to the drug therapy. Third, the patient will have an understanding of the drug therapy, adverse effects to anticipate, and measures to relieve discomfort and improve safety. During the administration of the drug, the nurse should administer Sucralfate on an empty stomach 1 hour before or 2 hours after meals and at bedtime to ensure the therapeutic effectiveness of the drug. Monitor the patient for GI pain and arrange to administer antacids to relieve pain if needed. The nurse should administer antacids or antibiotics if ordered between doses of Sucralfate, not within 30 minutes of a Sucralfate dose because Sucralfate can interfere with the absorption of oral agents. The nurse should also provide comfort and safety measures if CNS effects occur to prevent patient injury. Provide frequent mouth care, including sugarless lozenges to suck to alleviate dry mouth. Ensure ready access bathroom facilities if diarrhea occurs, institute bowel training as needed, and provide small, frequent meals if GI effects are uncomfortable. Offer support and encouragement to help the patient cope with the disease and the drug regimen. After the administration of the drug, it is the responsibility of the nurse to monitor patient response to the drug, relief of GI symptoms, and healing of erosive GI lesions. Monitor for adverse effects, GI effects, CNS changes, or dermatological effects. Monitor the effectiveness of comfort measures and compliance with regimen, and the nurse should also evaluate the effectiveness of teaching plan. The patient can name the drug and dosage and describe the adverse effects to watch out for, specific measures to avoid them, and measures to take to increase the effectiveness of the drug. That will be all for this video. I hope that you have learned something out of our discussion. Thank you for watching.